Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Monday. It is July 1st, and it is 5:04 p.m. Hope you guys are having an awesome first day of July. It is super, super hot here in South Florida. I think it felt like... Anyway, hello, Teresa. So back by popular demand to change the topic from the cancer series, which we've been doing, which I know is super important, but kind of down. So we're going to go back to the summer travel series. Okay, I did a little bit of this last summer, but I've been asked by a lot of people to bring it back and to share some topics here. So some of them may be similar, but some of them are going to be new. One area which I hear about a lot is how to deal with motion sickness. Whether it's in a car or a boat, it can really mess up your day. Okay, so my daughter had trouble in a helicopter ride in Hawaii, which totally ruined the whole thing for her. Okay, the sights were beautiful. We were over the volcano. It was amazing, and she felt awful. So what is motion sickness? Okay, motion sickness is caused when the inner ear, your visual field, so your eyes, and other means of perception are in conflict. Okay, they're not in sync, if you will. The eyes see one thing, but the inner ear senses something else. Okay, symptoms include upset stomach, heartburn, flushing, and then the worst, of course, nausea and vomiting. The best defense against motion sickness is prevention. Okay, it's probably true of anything that I talk about. If you can prevent it, it's way better than trying to treat it. So what can you do? Number one, stabilize the inner ear. Sit in the front seat of a car as opposed to the back seat. Sit in the front of the bus. Sit on the lower level of a train. Always face forward on a moving vehicle. Sit in the aisle of a plane that's actually over the wing. It is the most stable part of the plane, the least amount of motion. I mean, the whole plane is moving, we understand that, but the sense of motion is the least. And avoid routes on the highways or cars or whatever that have twists and turns and ups and downs. And avoid boating in bad weather. And of course, if you really are bad with motion sickness, don't find yourself at a roller coaster place. My favorite, but as I've gotten older, I've gotten a little bit more sensitive to it. So where I used to be able to go 1, 2, 3, 4 times, now it's just like one and I need a break. Okay, I need to let that part of my body stabilize. Number 2, slowly synchronize with motion. Ideally, start in calm conditions. Turn your head into turns so that you're kind of helping your body move in the direction. Move around in a plane, on a boat, and trains. Don't sit still the whole time. Don't let the vehicle move you. Kind of move yourself as well. And anticipate the turns and lean into them. Okay, especially in a car. So that's why you need to be looking up and paying attention. Number 3, synchronize your vision. On a boat, visualize what's called the true horizon and focus on a distant point, someplace out, which is more stable. Don't look at the waves in the water. Don't look at things right down. Look out far in the distance. Don't read or be on your phone while you're in a car. Again, focus on the road in front of you. Don't look to the side as the cars are passing. That's going to make it even worse. Okay, always looking forward where you're going at a distant point. In a car, also, it's not on my notes, but air conditioning blowing in your face is also another good one because it keeps that warm sensation away. It keeps a nice cool breeze in your face. Number 4, avoid behaviors that increase motion sickness. Avoid alcohol, avoid fatty foods, dehydration, and hunger. Sleep if possible to avoid fatigue. Now, that doesn't mean sleep in a car necessarily, because sometimes that can set you off again because you're not paying attention to the road in front of you. And ensure good ventilation. I guess that's where the air conditioning could have come in. Number 5, stay positive. Motion sickness has an emotional component, especially if it's coming on and you're feeling lousy. If you keep thinking or saying, you're going to pleasant conversation with someone and try to distract yourself. Number 6, medicine may help. Again, you know I'm anti-medicine, but sometimes this is the only way to go if you're really, really sensitive. If you get motion sickness every time you travel, consider a transdermal scopolamine patch. It works by blocking the action of acetylcholine and reduces symptoms of nausea and vomiting, which is really what you're looking for. Avoid this if you can, especially if you have open-angle glaucoma or any type of psychotic or psychiatric disorders, because it can cause confusion, agitation, and disorientation. It may cause visual changes as well, and it actually causes a really bad dry mouth. So make sure you keep a bottle of water near you so that you can avoid that. Other over-the-counter medications, antihistamines, or Benadryl may be helpful, but will often make you sleepy. So again, something you may not want to happen while you're trying to vacation, right? Number 7, natural remedies. Okay, here I am. Peppermint tea may be very helpful, or peppermint essential oil. Again, it'll help keep your breathing open, your airways open. It's a nice fresh smell. It's also really good if you do experience flushing, because it has a really wonderful cooling property. Ginger actually has the best evidence of reducing motion sickness. Make yourself some ginger tea, eat ginger chews, or use ginger essential oil. Really, really good to help with preventing and treating motion sickness. And lastly, acupressure. Now, it doesn't mean you're going to suddenly go off to get a treatment. This is something you can do on yourself. Okay, they do sell, I believe they do still sell them, motion sickness bands. But simple acupressure applied right here on the center of your inside of your forearm, on both sides. It's underneath those 2 tendons that you have right there on your wrist. Use your thumb to actually massage in a circular motion. Do one side at a time for about 2 to 3 minutes, then do the other side. You can repeat it as often as necessary, and it's a simple maneuver you can do. It also distracts you a little bit and may actually prevent you from having any problems. So, hope that helps for those of you who do have motion sickness when you travel. I'm so sorry, because it can really be a major bummer. So try some of these as preventative measures and hopefully enjoy your vacation. So with that note, I'm going to continue this travel series this week and next, and I hope you guys enjoy it. If you have any travel things you want me to look into, give me a comment or send me a message and I'll try and look into it for you. All right? So you guys have a wonderful day. I'll be back tomorrow for another Live in 5.